hang on. Put the rest of the noise down. What does sex mean to you? What touch do you enjoy? What fantasy do you enjoy? What is important to you at this stage?
Hi there, and welcome to Am I Crazy Or? The podcast where I, Lisa Påske, businesswoman, entrepreneur, and general troublemaker, take on all the ways that society gaslight us into thinking we are going crazy. This season, we are tackling the perimenopause. They often call it the second spring. I think it should be called monsoon season. But I'm not doing any of this alone. In each episode, I'll be interviewing and talking to experts, specialists, and women going through it, giving you all the information that you need to make more sense of this chaotic period of your life. In this episode, we are going to be discussing the topic that all of you listeners have been requesting the most: sex and perimenopause. There's a lot more to know than just dry vaginas and low libidos. So I am going to be chatting to Dr. Angela Wright, a clinical sexologist and a menopause specialist, and the co-founder of Spiced Pear Health. Let's get into it. Thank you so much for being here, Angela. I'm so excited to talk to you.
It is a total pleasure. Thank you for having me.
So, sex and perimenopause and menopause. So this is the topic that have been requested the most through listeners of the podcast. So I thought I definitely need to make an effort to try to find someone that can answer some of these questions. So tell me a little bit about yourself. So you are a menopause specialist?
Yeah, I'm a British Menopause Society accredited menopause specialist, but I always say I did that second. So the training I did first was my clinical sexology training, which is psychosexual therapy training for 2 years, and then I did sexual medicine training on top. There's a European Society for Sexual Medicine, and they do a sexual medicine school. So I attended that and did the membership exam. And then because I was working in general practice, I was coming across lots of women at our stage of life and around this kind of perimenopausal transition who were really struggling with sex. It was that made me do the British Menopause Society training, because it's clearly a trigger for lots of people.
Yes, yeah. It is. And I've only kind of like realized I am in perimenopause 2 years, and I'm 47 now. So it was like 45 where I was like, what is perimenopause? And then I was like, hang on a second, how long has this been going on?
Yeah.
But the more I talk to friends and people that are going through it, the more I realize that there's still so much we are just not talking about. Like, we are quite okay now about talking about HRT or whether to take or whether not to take it, and about the symptoms and all of that. But the topic of sex is still quite taboo. Yeah. Well, I don't know even if it's taboo or whether it's just embarrassing. Or...
It's just never spoken about well. I always think it divides into kind of like a Benny Hill jokey or almost a sort of it just grab a big sex toy and it's all going to be fine kind of thing. But we don't do a lot of vulnerable conversations about it, and we don't talk about it I don't think we're very literate about talking about it in honest ways. So I always think even when it's being discussed, it's not being discussed in the way that I end up talking to women about it in like that safe one-on-one closed consulting room space where people can be more honest.
Yeah. So what exactly happens during perimenopause and menopause that impacts sex drive? Is that one of the main problems? Is that what people come to you for?
Yeah, well, so we're taught by a psychosocial. So we're taught this concept of body, world and mind all kind of having an impact on sex. And menopause really fits that framework. So body, lots of hormonal changes in the body. So lots of changes in how your genitals work, whether you get sensation in the same way as you did, whether you lubricate. So the odds of you getting pleasure from what you've been doing previously, they change. And some people get a period where it really surges and things get a bit better in peri and they get more interest, but postmenopausally often it's kind of a negative change for a lot of people in terms of the loss of hormones. But it also impacts your brain and sexual thoughts and fantasy and, desire and receptivity to other people's initiation. So there's all of that going on. But also I just think we forget that we've got life going on. So there's kind of aging, and we're not in a very aging positive society. We're getting more images of women as they get older. that are kind of positive, sexy, affirming images, but that's fairly new and there's not many of them. You've got relationship. If you're in a long-term monogamous relationship, you've got all the challenges that come with that, especially if one of you loses your kind of your itch to get scratched, if you know what I mean. So, and a lot of life stuff happens. So if it happens at the sort of normal right stage, like in your 40s and 50s, so it's on time with an average menopause, many people have got kids, caring responsibilities, work, everything's just really intense. So loads of distraction, loads of stress. And if it happens early, it's often on the back of a health issue. So it's happening in the context of, a surgical procedure or cancer. So that in itself brings its own context. So all of it is changing. It's not just the body.
And what are some of the... Okay, let me rephrase that. What are some of the symptoms that people come to you with that they think is related to sexual desire?
Yeah. Okay. So I mean, most people come and say they've lost their libido. It's like we know what that is. So people come in and go, oh, I just don't want to have sex anymore. I'd rather have a cup of tea and like curl up in my pajamas. But I think that is the final common pathway if sex becomes problematic. So actually, when you dig into what's going on, there's often it's not pleasurable anymore because sensations change and they just say they feel numb, or it can be difficult to get aroused and to reach climax. So there's that pressure. There's quite a lot of pressure on women to climax. Actually, we sort of think about it as we sometimes have conversations about female pleasure as not being important, but in some people's relationships, the pressure to kind of finish and show that you've responded to magical touch or whatever is big. There's pain. So people are actively having like sandpapery sensation with penetration, infections after sex, just a real sort of sense of not enjoying being in their body. There's loads around finding ourselves desirable, not somebody necessarily wanting us, because there's often quite a lot of external, in a partnered relationship, quite a lot of external interest, but us kind of being able to inhabit that slightly strutty, sexy place that you sometimes need to get into to have sex, that can become really challenging. So loads of stuff.
I can see that. I think one of the things that I've heard the most mentioned, obviously the low libido, for when I was in my 30s, I had small kids and ran a business. Yeah. So I kind of knew that that would go to the wayside, but that is one of the most common things. But one of the things I wasn't aware of when I came into perimenopause, just how you physically change. Yeah. And one of the things that I struggle with that I didn't realize was even closely related was UTIs. Mm-hmm. And the frequency of those UTIs were like, for a year, I had like a UTI literally like constantly. And I had no idea that is because of how the vaginal wall changes. Yeah. So what happens there? So
again, and like so many people don't know, and I see so many women who've had intrusive investigations. So they've had, cameras passed up into their bladder. They're in their 40s. It should be blunt or obvious what's changing, but nobody seems to spot it. You get a number of things. So estrogen means that you have the presence of sugar in your cells, glycogen in your cells in the vaginal wall. And when we are in our fertile years, those walls turn over frequently. So we slough off all these kind of dead cells, and they feed bacteria that live in the vagina called lactobacilli. And they make lactic acid and they keep the pH of the vagina really low. And that's kind of crucial so that you don't get overgrowths of bacteria, fungi, and so on from sexual activity, penetration, and so on. We also have a biome in our bladder as well, which is influenced by the presence of estrogen. So when you lose your estrogen, the bugs that live in us and support us and help us to be healthy change. The tissues get thinner. The structures that sort of support bladder health become problematic as well. So like the trigone structures and the sphincters and so on become weaker. So you have this kind of perfect storm of more chance of infection, but also less sort of ability to sustain an infection without it giving you leaks and rushing to the bathroom frequently and feeling really awful. And all of the structures that are all of the internal clitoral structures, so not the kind of external bit of the clitoris that sits at the top of the labia, but the internal structures on the front wall of the vagina are along the urethral passage. It's all the same structure. So the bits that feel nice or you want to get rubbed when you're having penetration of some sort, you're sort of irritating that urethra.
Yeah.
And it's just not as resilient either. So you can get like a urethritis. So it can feel irritated even though you haven't got an infection. It just feels like you need to pee, even though there's not one proven. And there's lots of bladder changes as well. So again, it's like this perfect storm. Nobody knows about it and you just stop bothering.
Yeah, this is exactly what happened to me. I went to see the GP, a gynecologist, a urologist.
Yeah.
The urologist wanted to extend the urethra or something. And I was like, absolutely not. I don't want to do that. And then I came across the symptom of perimenopause and saw a menopause doctor, and I haven't really had any UTIs since I started HRT.
Well, that's kind of the good news. And even if you can't, I'm always conscious of the women who can't have HRT or who don't want to have HRT, but even if you don't want it systemically, almost everybody can have it locally on the vagina and the vulva. And it's, you can have it if you've had breast cancer on the vagina and vulva. And that's often all that you need to do is just put it back locally in enough quantity, because a lot of the licenses now for the products that we use are often a little bit lower than would be ideal for some women. So you can be using them but still be symptomatic and you just need a bit more.
Yeah. Okay.
So that's sometimes something to consider.
So the quickest solution for UTIs is that estrogen topically.
Yeah, but I had this conversation today in clinic with a lady who's like so much better than she was when we first started, but she still feels a bit like she needs to pee after sex.
Yeah.
And she's using an E-string, so one of those ring devices that you sit at the top of the vagina. If you come across them, you look really puzzled. It's it's like
What?
it's a little. There's a little ring. It's like a lubricated curtain ring. It's like this really bizarre device. I think they're great. And you self-insert, or you can get a healthcare professional to do it if you want to. They last for 90 days and they release 7.5 micrograms of estradiol on a daily basis. So you get the Vagifem, the little sticks with the tiny tablets, they release 10.
Yeah.
So for those, you get those twice a week in the licensed dose, which isn't very much, but Estrin gives 7.5 every day. So it's quite a good device. So I use quite a lot of them. I also use them a lot because they don't have any debris or discharge. They don't change the way you smell or taste. All of that is quite important when it comes to sexual activity and confidence. Yeah. So this woman loved her device, but because she wasn't using external estrogen as well and using a bit of gel on the outside of her vulva and rubbing it over the urethra, so with the exit from the tube where the pee comes out, she was still getting some irritation. So I just asked her to use a bit of the gel on her fingers and rub it around the urethra, and that will probably resolve it.
Okay.
But we tend to treat inside, we tend to treat to preserve penetration. Yeah. And we don't tend to treat vulvas and urethras and clitorises and labia, and they're all really important too.
And so so let's move to that. The dry vagina.
Yeah.
Is that the one of the main symptoms?
Yeah,
though?
annoyingly, yeah.
Yeah.
So, and that really inhibits a lot of women because, again, like we don't speak about sex very much. So in our kind of wordlessness in sex, if you're kissing and you get lubricated, it's a sign to your partner that what they're doing is good. And we feel good because we're like, I'm so responsive, and it's great. And when that all dries up, it can be so inhibiting. And again, that is like night follows day for most women. Postmenopausally, you get less blood flow through your vagina, about 30% less blood flow. It's the blood flow that leads to the wetness because it kind of pushes through the vaginal walls. So you just lubricate less readily. And there's all the changes in the walls as well that contribute to it. So you're often trying to have sex, but you're not adequately lubricated. And then sex is uncomfortable, which gets right in the way of your arousal and your climax, takes away your reward for bothering.
Yeah.
And then because it's rubbing and chafing effectively, you're more prone to an infection afterwards. So yeah.
Yeah, I think I've heard several women say that their partners think that they are not turned on by them anymore because they don't get wet.
Yeah, it's like when I deal with men who've got erectile dysfunction, you're in a heterosexual relationship or in a gay relationship, to be fair, you're dealing with a partner that's got the ED and how that feels for them. But you're often dealing with the unspoken message that's being received by the partner who's going, my God, you know, I used to feel so good that you had an erection when you saw me and you couldn't stop getting an erection when you saw me. Then suddenly the message is that something's changed.
Yeah.
And I think that happens a lot with women, even though this is so normal that you get this issue at this stage. I think it's become like the female ED, like we kind of feel like our response is a bit broken, and then often you sort of just shy away from bothering.
Yeah.
So it's, and getting people to use lube is not as easy as it sounds. Like people don't want to have to. I get lots of patients who feel really stuck at the concept that they should have to do something to augment this process.
Yeah.
When it used to happen really easily, and often it was like the glue that held the relationship together.
Yeah, no, I totally get that. I'd never used lube before my 40s, and I definitely thought like, oh God, what is going on? Like, am I wanting less?
Absolutely. And like porn hasn't helped, because obviously in porn it's become like a thing, hasn't it? So we've got like squirting and everything else. And so this idea of like, you know, you are a responsive, sexy kind of person, and that's somehow associated with how easily you lubricate, is like going into the psyche of women, and it makes them feel even less sexy.
Yeah.
So yeah.
So the number one tip that you would give for vaginal dryness is it to try estrogen?
Yeah, I mean, I'm always really hesitant at saying like HRT is marvellous and that's what everyone should do, because I know it's more nuanced than that. But for vaginas and vulvas, if you can have estrogen, and like I say, the vast majority of people can. So even the guidelines you've got around breast cancer, tamoxifen users, aromatase inhibitor users is becoming much more positive about using estrogen. It's a game changer. It's really difficult to improve things as well without it.
Yeah. And what about lubricants and moisturizers? Because I was also recommended moisturizers.
So again, I think it's about working out what you want and what's going to suit you. So lube is really, I mean, lube is great if you're 20. You know, if not everybody lubricates readily every single time, regardless of what's going on. So getting used to the idea of having you can get really nice sexy bottles of lube that sit on the bedside cabinet. Uber Lube do a really nice sort of set of coloured, shiny containers, so it doesn't have to feel like it's this horrible tube of KY.
Yeah.
And just getting in the mindset that is part of improving your odds of having pleasure, and getting to incorporate it into how foreplay works. Because sometimes even just that beginning bit of lubrication starts you off feeling pleasure, and then your body kind of like kicks in with a little bit more help of its own. But you do sometimes just need that initial,
it's like engine oil, basically.
Yeah, exactly. Yeah, a little bit gets more. And I tend to get people, I mean, you've got to choose what suits you. Classically, as in sex therapy, we often do double glides. So we talk about oil-based plus water-based lube. And yes, lubes do a good oil-based and a water-based. And the two together, because it doesn't mix, gives you a slippery lube like all the way through. It doesn't tend to reabsorb. So that's quite nice. But people like hyaluronic acid lube, like Subtil. Some people like using a silicone lube, like Uber Lube. So it's about, like anything else, like finding out what sensation you enjoy, what's going to be condom safe if you're using condoms, because oil doesn't go with latex. You'd need to use something different.
And is there any particular lube that is better for women perimenopause? Because our pH level
pH
also
is
change.
important. Yeah, it's a good point. So you want something that's skin safe. You want something that's pH balanced, and I use those names because those brands are. But some of the over-the-counter, like the flavoured ones and KYs and stuff, they're not good, and they contain things that aren't great for the vagina and the vulva. They irritate or pull more fluid out. And you need to check if they're osmotically balanced, so that they're not hyper-concentrated, which effectively almost draws more fluid from the tissue. So you need, and it sounds really weird, but I mean, like Yes do Yes But, which is a specific anal lube, and like different parts of the body. It's brilliant. Great
name.
Marketing. It's just like amazing marketing. But it's a pH of 7 because it's designed for anal mucosa. So it's got a completely different remit. So depending on the kind of sex you want to have, you actually need to think about the right lube for the right thing.
Interesting. Love that. Okay, so one thing that I feel is quite a big challenge for women as we get into our mid 40s, late 40s, is that I think we kind of believe that we somehow are less desirable as our hormones go down. Like the hormones is what made us attractive.
Yeah.
Like I think it's almost like we've convinced ourselves that is the thing. Yes. I even used to do I used to do stand-up comedy. I used to do a joke about it. I was like, my hormones are on the last leg and this is it. Now everyone's attracted to me, but it's not going to last.
It's really challenging because we don't exist in isolation. It's all contextual, and we grow up with loads of quite misogynistic, unhelpful messaging, actually, that would tell you that you're at your peak of attractiveness at like 22, and then from that point onwards, you're just this declining, shriveling thing that's got less and less value. And if you examine it and take it apart, there's so much sex that people have that isn't for reproduction. In your fertile years, like when you're ovulating, you do tend to have more interest. They did this study that showed that lap dancers in the US who ovulated made $180 more per shift than the lap dancers that were on the pill. So It changes our behaviors, our pheromones. Yeah. So there is that element. It does drive part of why people have sex. But there definitely doesn't drive all of the reasons that people have sex. Otherwise, we wouldn't have same-sex couples. We wouldn't have people still having sex on contraceptives. We wouldn't have lots of people wanting to have sex into later life. We wouldn't have, cougar dating sites. We wouldn't have... And sex is so much bigger and behavioural and cultural, and it's a bigger subject than just the kind of biological driver. And I think, speaking for my experience of working with women, often the woman in front of me is not convinced of her own attractiveness. And she doesn't feel desirable anymore because she's spent 30 years always wanting to be half a stone thinner, half a cup size bigger, slightly better bum. You've always been working towards, if I just do this, I'll be, what I could be. So it's followed her all of her life. And this is the point where it actually gets very difficult because you can't, beyond a certain level of effort making, you can't outrun your age. But she's often with somebody who is really interested in her attractiveness, still finds her really sexy, is able to appreciate all sorts of different body types and ages, and the wholeness of a human being, the whole sort of sexuality and sensuality of a human being. And there's a real mismatch, I think, between our sort of almost internalized misogyny that we have and our comparisons with 30-year-olds and 20-year-olds, and struggling to have enough images, and we're getting more of them, thank goodness, of the Davinas and the Gillian Andersons and the people that, are at this stage of life who are not giving up, not hanging up their femininity. My mum cut her hair off at 35. She thought she couldn't have long hair as she got older. Wow. Because she wasn't meant to have that sort of feminine symbol. And we don't do that anymore.
No.
So
yeah, that's really interesting. I definitely had a worry that I would feel less attractive and that I would kind of dwindle. I was also married and I got divorced, so that had changed a lot. But I now realize that what it also has done for me, at least in now 47, I don't care as much. I ran out of fucks, and now I'm just like, fuck it, this is it. Do you want it or not?
And there's I think I said this to you when we were planning this podcast. I was listening to Cindy Gallop talk on another podcast about this issue, and she exclusively dates men who are 10, 20, 30 years younger than her. And, there's all this conversation about, but what do they see in you? And she's like, well, they don't have to spend the entire time paying the attention to often quite a lot of insecurity that we have when we're younger, quite a lot of need for reassurance about, because I don't know about you, but you don't always feel great when you're 25 because you still compare yourself to other people. And so something that I think happens at this stage is we become much more aware of our own voice. We can be much more confident about, working out what we might actually want and asking for it and vocalizing it. We're not distracted by young children anymore. Often people are on second and subsequent relationships, have learned a pile of crap about what didn't work for them and are much more empowered. So a lot of it is about, a lot of what we have to work with, and the focus in clinic a lot of the time is, hang on, put the rest of the noise down, and what does sex mean to you? What touch do you enjoy? What fantasy do you enjoy? What is important to you at this stage in terms of what you want in your life? And if you've got these ideas about your body, let's just examine where they came from. When did you first become aware that you didn't think that this was how you should look or how you should be? Where did that message come from? What was motivating the person who gave you that message to give you that? I mean, usually it's just like commercial. I don't know about your social media feed, but mine just bloomed with your skin's no good, your hair's no good. You need to, as soon as I hit 40, it was just this massive commercial. So some of it I think is about being smart about who's actually sending those messages, because it's not played out in the bedrooms across the country. It's a sort of a social media commercial myth that's being played out to drive people to worry and spend money.
Yeah, that's so true. And I totally see that I think it was like, especially when I hit 45, it was like a button, and then suddenly everything was about losing weight, and
exactly, your algorithm just like flipped.
Oh wow. And I was like getting divorced, it totally changed. Actually, talking about weight, I think this is one of the other things. So it took me quite a while. I reckon I was actually started perimenopause at 40.
Yeah.
And so it was 5 years before I realized before I started HRT, and I had loads of problems in that time. But one of the things that I really struggled with was weight, and I just couldn't lose any weight, and I just felt really bad. And I know a lot of women put on weight during perimenopause, and then that contributes to
and it's like your body's out of control, isn't it? So it's just, and you flush, you feel like you can't, everything you did, and actually I think we've often only just got our shit together in our 30s of like working out what works. So and I think usually once you get your HRT sorted, if you look at the data, if you're going to go down the route of HRT, it is associated with body weight maintenance more than not being on HRT is. But if you don't go down the route of HRT, then it's more that you have to really change what you've been doing previously, because physiologically you're quite different and you've got to figure that out. And I suppose the more we talk about this, the quicker it is for people to kind of work out what they need to do to get their body to respond to their efforts. I hear a lot of people who say they're trying really hard and they don't lose weight, but when they, increase their strength work and everything else, they sometimes get a breakthrough. But again, it's about shifting narratives about, and again, how much therapy can people afford to have? But it's shifting narratives about who your body is for. Your body is something that's there to receive touch, to receive pleasure. And so many of us are just focused on our body as something to look at, to please another set of eyes. And so much of our learning about sex is as a partner. It's almost like, can I be picked? Will somebody want to be with me the most? Am I good enough to hang on to this person? Will they want to have sex with me? Do they find me desirable? And so much of it is not, what am I getting from this? Am I enjoying this?
Yes.
What do I want to look at? Let's look at the torsos that I'm getting to feast my eyes on. Am I happy with those? And when you put it into that framework, and just again, like reminding people where the messages that they've internalized, that they're using to string themselves up with, where they've come from, and, equip them with information and choices so that they can feel back in some control. But a lot of it is just, I don't know, we've had years and years and years of this stuff that we've been given. One of the nice things about menopause is often your sort of bullshit filter falls apart, doesn't it? It just kind of goes.
Yeah.
And that's actually really helpful.
Yes,
So,
it is. And it's really freeing. I found that part the most freeing.
Yeah.
Like, I think for me, it was also in at the same time I was getting an ADHD diagnosis, and that also impacted it. But I do think all the anxiety and stuff I had about sex and the way I look and being attractive and stuff in my 20s or even in my 30s, where I would just felt like ragged, stressed out, running a company and a household, etc.
Yeah.
Like now is the first time in my life where I'm really asking myself, what do I like? What do I want? And that is so freeing.
Yeah.
And actually discovering, like, I reckon I am more actually in my body.
Absolutely. Yeah. Yeah. Well, and
ever.
that's, God, I've worked with 20-year-olds who look, I don't know, like the archetypal perfect body, you know, like the kind of the one that everybody shows in the media. And I've had those girls say they've had maybe sexual pain or something, and I've suggested that maybe they go on top of their male partner so that they can control the depth of penetration. And they've looked at me in horror and gone, but they'll be able to see me and I'll be moving. And that inability to be in your body, to move your body in the way that feels good and not almost be watching yourself from the side and sort of judging your own performance and what you look like and whether everything's wobbling.
Yeah.
I think it affects loads of people, actually. And so we lose track of sex as something that feels good primarily, that is kind of about movements that you want to make because you want to touch, you want to feel, you want to be selfish, you want to grab and take something. And I don't think that's how it plays out in lots of bedrooms. I mean, I see a set of people who are having problems, so I don't see the people that are having brilliant sex. I see the people that aren't.
Of course.
But it's because you're often doing something performative. You're going through the motion of what you think sex should look like or what you think your partner might want, but you've disconnected from what it feels like and what touch you might want a bit more of and what position you might need to stay in a bit longer because it's really working for you. And the sense for a lot of women that they take too long also kind of gets in the way, or that they're too complicated.
Yeah.
Oh, don't worry, you have a freebie because it'll take me ages, and that kind of sense that you can't ask somebody to indulge you for 30 minutes if it takes 30 minutes. Yeah. That idea that we deserve to take up space and that someone giving us 30 minutes is a gift to them. Lucky them.
Yes.
It's not easy for people to kind of have that mindset, and you need to help people to shift it slightly. Yeah. Because the reality is, most partners are actually really willing. That they are.
Yeah. I know. I totally see it. And I remember someone said to me like a couple of years ago, said that I don't know why we worry so much about how we look when we have sex. Men are just happy to be there.
I mean, it's such a cliche, but I was talking to someone, I went for dinner with a good friend of mine last night who's a sexologist, and we were saying there is a niche for everything. There is whatever your body size, shape, state of your vulva, sexual preference, everything. There is somebody really excited to have sex with you. And I think we get so fixated on this misogynist size 8, hourglass figure, shape of what we're meant to be, usually under the age of 30, that we believe that bullshit as if it's truth. And it's not truth for lots of men's reality, certainly a lot of men that you'd want to be sleeping with, their realities. And for the few that are fixated on those hyper young bodies, for me, I'm like, well, it's not a great loss that they're not looking at me anymore. I'm okay with that. I'll go for the ones that are going to be excited to, to be with me.
It's a filter. It's a good filter.
It's a really helpful filter, right? Yeah. Like, it's, would you let somebody only date you if they liked your car? Would you let someone only date you if they liked your whatever? It's, so I think we have to have a better sense of our own value and not be so bloody apologetic for it,
Yeah, exactly. And I think it's a space for like reframing how menopause is now, like going into this transition also means it's our turn. Yeah. And it's my turn to actually concentrate on myself and my pleasure.
So if you look at the orgasm gap data, so there was
what is the orgasm gap data?
So there was a study that was done, maybe 5 years ago, looking at your likelihood of having an orgasm depending on what kind of sex you're having and who you're sleeping with. So they started by if you're male-bodied, female-bodied, and you're in solo sex, so you're just working on yourself in a private place, doing whatever touch is going to work for you, 95% of us can climax in minutes. Yeah. when you put men and women in a heterosexual relationship, and it's a long-term heterosexual relationship, what they found was that the male orgasm rate stayed really high up in the 90s, and the female orgasm rate dropped into the 60s. I think it was 68% from memory. When you put people into hookup relationships, so dating, the female orgasm rate fell as low as 18%.
Oh, wow.
I mean, 80%, 60 to 80% of orgasms are faked, so most people sort of make the noise.
What? How much?
A huge proportion, depending on what study you look at.
Wow.
For the orgasm data, they found that women that had sex with women had a consistent 85% chance of having an orgasm. The reason being, everybody doesn't think they know what sex looks like, and it's not all penetration focused when women have sex with women. But when we meet a new partner, we don't tend to sit down and go, so what body touch really works for you? And how many minutes of foreplay would you like to have? And do you like oral sex? And how do you like it? And you're doing it like painting by numbers, going through the motion of what you think it should look like, because we've all seen it, right? And so people are disconnected with what they're doing and whether it's actually working for the person in front of them. And you get into bad habits because it's embarrassing when someone's trying really hard and it's not working. So people fake, because otherwise it might go on forever. Like how long are you going to let someone rub half an inch to the side of where they need to be rubbing?
Oh my god!
And like we know, like we're empowered women, and we're like, I know I should move that hand away and move it, but sometimes it's just really frustrating because it slips again, and you just kind of go, oh god, I'll just do it later myself, And so we get into these habits of putting up with not very good sex. So I think there's a real mindset shift that needs to happen. Like you say, part of that kind of, that sort of bullshit filter falling off at this point, if you employ it properly in this area, can be quite a good, positive thing. I've got lots of women who are, especially those in new relationships, they're often the ones who are doing better at this point. The monogamy bit, the long-term monogamy bit, is often a challenge.
Yes, that is a good point. And that's where I've had a lot of suggestions to questions to ask you, especially around how to talk to their partners. How do you talk to your partner about how perimenopause, menopause is changing how you feel about sex? Because I have friends that are like, well, I kind of told him, but he doesn't really listen. And so first question, how can you talk to your partner about how your body is changing and what you need? Is there
I don't think there's one way of doing it, because obviously different relationships are set up in different ways. And I think it can be helpful to share a book or to share a podcast or to do something that feels bigger than just you. If you're fearful that you're not going to get listened to. But then, see, that's a bigger issue for me. If you're in a relationship with somebody who's not going to listen to you, then the issue is the relationship. It's not about your body changes. It's about the fact that you're not being acknowledged. But there's loads of resources that you can share now which take the burden off you and just go, look, this is an absolutely expected, unavoidable transition through life that we go through. If we're knowledgeable about it and if we can seek help, there's loads that we can do to kind of make it better. But actually, that's not what people are often asking. What they're often saying is, this has been a bit annoying for 15 years, but I've been able to put up with it because there's been no significant negative consequence to me. Now I am exhausted, I'm sweating, I'm not sleeping, I feel shit. It gives me a UTI. I feel like I'm touched out, like just don't come near me, and something's really shifted. It's not often that, sometimes it's that sex was brilliant and then suddenly it changes. But for a lot of people, it was kind of all right. It wasn't a priority, it wasn't dreadful, but you still put it together on holiday and after a date night. And it's just gone down a notch, And that's actually more about you haven't probably been communicating on this subject for quite a long time, and you've reached a tipping point, and you could look at it as a good opportunity to reframe it, start to communicate, kind of like, raise it all to the ground and start again. Yeah. And I sometimes get people, I don't think you've got it on your bookshelf, I thought I could see it. There's Mind the Gap by Karen Gurney, is one of the books I often talk about. It's a great book. And you can do that as couples. You can often do that with both partners reading a chapter at a time. and then coming together over a glass of wine, you know, at the end of a week and just discussing. And the tip we use in therapy is that you speak from an I, you use the language of accountability, you use I language. You don't do that kind of, but you're always trying to come quickly and you're a bit shit. You don't do that. You do the kind of, I always really enjoy it when you spend lots of time touching me, or I love it when I have a massage. I had a really great supervisor when I was doing my training in Doncaster. He always says in conferences, you know, when you're in your 20s, you're like a microwave, 30 seconds and you're ready. When you're in your 40s or 30s, it's more like you're a conventional oven and you might need 10 minutes to warm up. Menopause, it's a bit like being an Aga. Like you've got to put it on, like, you know, for a day or two. And I think there's truth in that. I think foreplay needs to kind of start from the end of the last orgasm. It's an entire mindset of like threading sexual currency through your week. You can't just turn over at 11:30 and pop your hand on a boob and kind of expect that to be enough at this stage, you know? And everyone benefits if you tackle it. You know, that's the thing. It's not like only one person benefits in this if you just talk about it. And I think it's really important to remember it's not just women's bodies that do this, because we feel like we have this timer on us. But 40% of men over 40 have got erectile dysfunction, and the statistics just rise. Wow. A huge proportion. I think it's over 45s. Again, it's about 40% that have got low testosterone, and they'll have some sexual dysfunction usually as part of that if they're symptomatic. Low testosterone doesn't always mean that you're in need of more. You need the symptoms as well. But this is really prevalent. Men's bodies, their touch receptivity is less good, so they often find it harder to reach orgasm. It can become more delayed. They get prostate problems. It's not just us with bodies that age and change, and we just hold this kind of shame about it, but it's not. It's everybody.
Yeah. One of the statistics that I find absolutely shocking is just how huge the divorce rates are once you get into perimenopause. Like, it feels like it's a huge link there between divorce and women in perimenopause. But men might not know that this is happening. Do you think that there is a link between this?
Oh God, I mean, I think midlife anyway is a developmental stage. Like and for men, it's the point of life where their risk of suicide is highest as well. Again, it's a parallel. Like, women do have a huge transition, lots of emotional impact. For some women, if you've got neurodivergence, if you've got premenstrual syndrome history, that kind of hormone sensitivity, can really be a super challenging period. And it can lead to things like increased impulsivity and, like, you know, I've had enough, I'm walking out, that kind of thing. So yes, the hormones are part of it. But I also think midlife full stop, regardless of gender, is a sort of time's getting on. I've only got one life. You know, I'm starting to see people in my age group die. My kids are a bit bigger. Is this really working for me? And often culturally, we sort of really celebrate people that stay in long-term relationships, you know, all the way through life. But there is a bigger question about whether that's always the right thing to do for everybody. And I think it's more culturally acceptable now for people, and women have got more financial ability to sustain themselves without needing to stay in a relationship that isn't working for them. So I think people reevaluate a lot at this stage. I would say that for a lot of women, I think if they knew that they were perimenopausal and they were able to access support that helped them with their symptoms, it would just clarify their ability to work out whether that's the right decision or not. Because I do see people who kind of look back with some regret about some of the things that happened as they went through that transition. But for others, I'm like, I think it's the rose-tinted glasses come off. Like, estrogen is quite a rose-tinted glasses hormone. It makes you want to nurture. It makes you want to sort of, you know, protect relationship. And as we lose that, I think I said to you before, you know, I think we look around and go, which dickhead set up this structure that's got me doing everything and like running around and caring for everybody. And then if you're not in a relationship that's supportive of that process, and one of you is going, this isn't working for me anymore, and the other one isn't prepared to say, oh, okay, like, let's sit down and what can I do to support you, then it can be like the straw that breaks the camel's back. And you don't, should I say this? You don't see all that many women who feel regretful 5-10 years on from that split. Often it was the right thing to do.
Yeah.
And it's just that was this most stressful tension point. I don't think it's about sex necessarily. I think sex is often the glue that holds a relationship together. But I think often those relationships were really, really struggling. And then this came in and it was the thing that was just pushed them over the edge.
Yeah, I totally see that. Is there anything that men can do to help support a woman through perimenopause?
Yeah, be nice human beings. And, and lots of them are. Like, I'm not suggesting they're not. But I think understand... We tend to look at the world through our own virtual reality headsets, right? So I'm looking at my day in the context of my own lived experience. You know, your partner will be looking at it from a different direction. And just having that ability to understand that what you're perceiving from your angle may look very different from the angle of the person that you swore 20 years ago that you loved and wanted to stay with for the rest of your life. And just giving them that kindness of... asking them what's going on, asking them what help they can provide, doing a bit of research and looking into this, because it's a transition that's probably going to go on for the best part of a decade. So it's not a small thing that's going to go away. And not dismissing it. We're so dismissive about hormonal problems. We tend to use that as a way of diminishing women and dismissing them. Like, oh, it's just your hormones, love. It's a very, very biological, physiological change that we go through. And it can be much better on the other side, actually, as a result of some of the stuff that you put in place through this process. And so I think, I think there's something about leaning into it, offering support, communicating, like talking about how you're feeling and what you're both needing. The danger is when there's disconnect and you sort of end up in your own separate camps, interpreting things from your own different direction, and no one's being sort of honest or vulnerable about how they're changing and what they're needing. Yeah, that's really sad, and I can see that happening all over. But I do work with men as well, and I'm always shocked at the parallels. I keep bringing them up because I think it's important that women don't think it's just us. And like men who have low testosterone, you know, they don't know how to experience their libido in the same way anymore. They miss having the drive. It's the same stuff that we talk about, you know. They miss it. They don't know how to access that part of themselves. They have hot sweats. They feel emotional. I think some of these things are human transitions, not just women's transitions. And the more that we're able to sort of look at it in that way, I think the better it is for everybody. Yeah. And is there any... Are you able to have a regular, healthy, exciting sex life after menopause? Yes, I spoke to somebody who I've been working with in clinic, not just because of, it's not just me that's made it happen, but she's having sex a good 5 to 7 times a week now because things are much better. Yeah, and you get people that get into new relationships and they go into that honeymoon phase and they're shagging all the time. And it's about unpicking what's actually going on. So there are body changes that need addressing, and you can do that in lots of ways, but the vaginal estrogen is quite a fundamental bit, and lubes and things. But the systemic stuff, there's lots of different ways of approaching just feeling okay in your body again. But so much of it is about the identity. It's about understanding how libido works, because I think a lot of people expect it to fall from the sky as like, you know, like hunger. It's just an itch that needs scratching, which it does early in relationships, and it does when you're ovulating in your 20s and stuff. You do have more of that spontaneous desire. But for most people in long-term relationships and for people that have lost that hormonal driver, a lot of our desire is much more like walking into a supermarket, not feeling like we want to eat when we go into the supermarket. And then you're walking up the aisle and you suddenly smell the smell of donuts cooking and you feel your tummy rumble and you start salivating. And that's arousal. Okay. And that's called responsive or receptive desire. And that's 75% of how women tend to feel their desire. It's not, whenever I say this, someone goes, no, mine's all spontaneous. And that's true. And lots of neurodivergent people feel much more spontaneous desire and so on. There's all those differences. But for a lot of people, it's about in comes a cue. I feel arousal in my body first. Arousal before desire, okay? Oh. Something happens in my body or in my brain, and then if I've got no reason not to, I will feel desire. So if you use a food analogy, you've got to be smelling and looking and conscious of what's going on to even notice the cue in the first place. You have to remember the last time you ate a donut, it was bloody delicious. You can't have had a tummy ache or felt shit about yourself for doing it. It's got to be a positive memory. And then you've got to put yourself into context where you're going to smell donuts. Like, you've got to create situations where you might feel some desire. So you might need some erotica, you might need to do date nights, you might need to have some deliberate touch with a partner like massage, you might need to do some work if you're in a long-term relationship where there's courses you can go on that help you to rekindle desire and look for novelty. You might need to do something to create the scenario that allows, but you can feel arousal first and then desire afterwards. It's how most of us do it.
Oh, that's so interesting, because I had never thought of it like that.
We just think it's going to be like hunger, like your tummy grumbles. But food's a great analogy, because how often do you eat because your tummy's grumbling rather than because something that's delicious over there? Or those people are eating and you quite fancy because you started salivating. Yeah. Sex can work in just the same way if we get out of our own way. But often there's a blocker. So you get the, I don't know, you might catch your partner walking across the room and think they look hot, and you might get that little moment of something. But if the last time you bothered you got a UTI, or you felt like you were dry and it became really shame feeling for you because you sort of had that moment and then your body didn't respond, you won't act on it. So you have to deal with all the little blocks and go, okay, I need to know that I can be confident that when there's touch, I'm going to be lubricated. I need to know it's going to be comfortable. I need to know I'm not going to get a UTI. I need whatever I need to make my body feel like I feel confident, Sometimes for people, they feel most confident on holiday. Or I had a woman today who was talking about she likes wearing a fishnet body stocking because actually it kind of helps her have a bit more of a feeling of feeling good in herself and not wobbling quite as much. And it's whatever works.
Yeah, whatever works for you. Yeah, that is great advice. Thank you so much. Thank you so much for being on the podcast.
It's a total pleasure. Thank you.
Oh, I feel like I could have asked you a million other questions. Hello again. Thank you so much for listening. I hope you enjoy that. I would really love to hear any feedback you might have or comments, or maybe you have a suggestion to a topic we should cover. You can get my email on the website or send me a message on Instagram. Please do follow the podcast and maybe even leave us a 5-star review. It really helps to get the message out. See you next week. Questions echo in my mind, searching answers can't seem to